From Global, Marnie.
Good afternoon, Dr. Rusin. Are you able to provide a little bit more information on the death of the woman in her 30s from Interlake Eastern? Did she have any underlying conditions?
Yeah, so I don't have a lot details on that, and I mean all of the deaths we announce here are tragic, right, that we see, but especially when we see a young person die of this virus, it really we all need to take that moment of pause. So there were some underlying conditions, but still, it's really tragic when we look at all of these deaths that we're announcing every day here now. But especially when we see such a young person.
And just kind of adding on to that, I know before you spoke about kind of just the ranges in ages that we're seeing for people in hospital and ICU. Can you provide just an update on the age range of the people that are hospitalized due to COVID right now?
Yeah, so there is quite a range. So I mean, in hospital right now, there's approximately like around 30 people under the age of 50 that are in hospital right now. Um, Nine of which I believe are in ICU. So there are young people that are seeing significant outcomes with this.
From the Brandon Sun, Michelle.
Yes, good afternoon, Dr. Lucen. My first question has to do with outdoor recreation spaces being closed again and equipment removed. Considering the risk was deemed low for outside activities and there are positive physical and mental benefits associated with recreation activities, especially, for example, school play structures, which are used during the day by school children, then closed outside school hours. So, can you sort of outline a little bit of the rationale for that?
All of it is again the balance and trying to keep the message as clear as we can. And so the message is we should be staying home as much as we can. And so these, being outdoors, doing things that are individual or with our family unit outdoors is great. Stay active, get that. Say getting to a hockey rink with 20 children outside, not that great. So we need to have that balance. You're right. Being outdoors, being active has a lot of benefits, and so I'd still encourage Manitobans to stay active. But mostly, that's got to take care within your family unit, right? We're not going to socialize with people outside of our household because right now we're just so critical. We don't have time for nuanced messaging. We have to just be staying home, socializing only with our household right now. We'll get back to all those things.
Okay, thank you. My second question is having to do with the rules related to hunting and harvesting. So it's deer hunting season right now, and people are going out. We did ask the health department, and the reply was hunting is permitted under the orders. That said, we urge Manitobans not to socialize with those outside their household. Now, that being said, which is fine, but do you have more detailed guidelines to offer, as hunting is often a small group activity with the aim of providing much needed food in many cases, and often involves two or more people? And it's not necessarily a household activity. So can you be a little more specific with guidelines related to hunting and harvesting, please?
Yeah, and so for all these things, and this is why we talk about things like the fundamentals, it's because it's really hard to have guidelines for every possible eventuality, but the fundamentals apply to all of them. And so we have the rules, right? So the group size is 5 right now. So that's going to apply indoors or outdoors. Uh, what we're messaging is even better if that's all people from your household, if possible. And then you want to do whatever you can to keep that distancing, ensure no one there is ill, frequent hand hygiene. So there's a lot of things that we can do to make these activities safe, and certainly the fundamentals apply and the group size orders apply as well.
From CJOB, Will.
Good afternoon, Dr. Rusin. Although we've heard about it happening elsewhere, I think some people may still be a little shocked to hear about the death of a person in their 30s. Could you just elaborate a little for us on the level of risk facing younger people? I'm thinking kind of in 20s and 30s, that sort of thing.
That's right. So I'd say that from what we've seen is that age is is typically the biggest risk factor for this. People over age 60 are quite at risk for severe outcomes, and then certainly underlying medical conditions and any things especially respiratory, cardiac or immune systems. Then people of any age can be at risk with it. And what we see is that when we're talking about risk, right, risk is a proportion, and so the risk here for younger people is certainly lower than people with underlying medical conditions or people with over age 60. But when you start seeing hundreds and hundreds of cases a day, then now that low risk starts showing up. Even though it's a low risk, where we're getting hundreds of cases a day, so eventually we're going to see less common things occur. And so this virus, no one is immune from this virus. No one is immune from a severe outcome from this virus. Certain people are at more risk than it, and then no one's risk is truly their own. We can spread this virus unknowingly and certainly unintentionally. But the best thing we can do right now to protect ourselves and the people around us is to reduce the amount of contacts we have.
Okay, thank you very much for that. I know Mr. Gusta usually provides these details, but I'm wondering if you have with you our current ICU capacity, if we've added any new beds, and also the test positivity rate for the Southern Health region, if you have.
Yeah, so I don't have the ICU capacity overall. I know we have 41 patients in ICU. As far as the southern test positivity, remember we don't share these commonly because the denominator's so low. There's a lot of variability in the rural regions, so we don't really like to share those because they're less valid than what we see, say, in the Winnipeg, where we have so many tests being done.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Rusin. Scott Bill, Winnipeg Sun. I hate to drone on about this, but I got to go back to these restrictions. Why are people allowed to go to stores, allowed to gather in people of 5, when the messaging is counter to that? Like, I mean, we have a public health orders that suggest one thing and strong messaging that suggests another thing. You have said that you can't, it's not easy to mirror both in it, but people will take if you give them an inch, they'll take a mile. We've seen that. That's why our numbers are what they are right now. So why not just mirror them? I know you say it's difficult, but I mean, at a time where these numbers are out of control, why not make it, whether it's difficult or not, do it anyway?
Yeah, so so I'd say that the messaging and the orders certainly aren't contrary to each other, right? Like we have strong messaging about staying at home, and alongside of that, we have our most strict gathering sizes we've ever had. So they're not exactly mirrored, but they're keeping along the same lines. Right? We've never been at group sizes 5 prior to this. And we've never had it even applied to private residences. So we are way more strict than we used to be, even with the orders. Although the messaging, yes, is even more strict. So I can tell you that it is something we're reviewing. We want to find a way to just remove any any such distraction with it, that we can provide an order that is enforceable, that we can actually enforce, and that still maintains a level of clarity that people can try to that people will be able to follow. So we are looking at that to bring them closer together. It is challenging. As far as why people can go to the store, again, it's we need to be able to have access to critical items. And then you find it challenging to narrow that when you have stores trying to essentially get around the orders. I think anyone can know in the spirit of the order what a critical business is. I think anyone can see that when our ICUs are almost full and we're trying to keep Manitobans at home, I think anyone can see what really is a critical business and what isn't. But apparently that hasn't been done. That hasn't been actioned. So we're going to have to find a way to ensure that is actioned. And it is a bit challenging to come up with that level of detail to ensure the spirit is followed, but we are working on that and hope to have something really soon.
Thanks for that. And I guess I'm just kind of a follow-up to that, and I guess you sort of answered, but I'm just wondering how Manitobans can put faith in these orders, these guidelines, when they can, easily find, quote unquote loopholes, or they can essentially just poke holes in. So, like, how can people have faith in a plan that it to some might not seem, I guess, effective?
Well, I think lots of laws and lots of regulations, have those type of things, and that's why creating regulations is difficult, and it often takes a long time to make these, a lot of engagement, a lot of looking at potential, unintended effects, a lot of reviewing. So we just don't have that time when we put these public health orders in. So it is a challenge that way. But you can find examples of many laws that have ways that people have found, to deny the spirit of them. So it's not unique to this. And so what I would say is that in a crisis like this, in a pandemic, there isn't going to be a restriction that's written down on paper that's going to get us out of this without buy-in from Manitobans. Right? We can't possibly be at every household counting the amount of people in there. We need the buy-in from Manitobans, and that's the most important thing. That's why we're here trying to message as much as we can how important this is. That's why we're here trying to dispel myths that we see in social media, because we really need that buy-in. And the public health orders are necessary, but they'll never be sufficient. We need the buy-in from Manitobans.
From CBC Radio Canada, Laisa.
Hi, Dr. Rustin. My first question will be about restrictions. I just want to know if the government is considering reimposing 14-day self-isolation rules for travelers from Western Canada, where we are also noticing like spikes in cases and hospitalizations.
Oh, wait. Yeah. So as far as the self-isolation orders for travel outside of Manitoba, we're not changing that as of yet. We're not contemplating that. The epidemiology around us and here in Manitoba don't support really any change to our travel restrictions. So we haven't been looking at that. Certainly, we review these things all the time, but we don't have immediate plans on that. And then I didn't catch the last part of your question there. Sorry.
So I was asking if it's something that you are looking at now.
Yeah, not specifically, but these are always things that we're reviewing.
Question will be today. Premier said the province is filling charges against standby protectors. In addition to fine, are you able to bring clarification to this? What kind of charges and about how many?
No, I don't have any specifics on that. I think it's just, right now we need to be clear with Manitobans that we have to be able to step up right now. We don't have time anymore. Our ICUs don't have the space to allow us to deliberate on these restrictions. We all have to do our part, and it's got to start last week, but certainly needs to be now.
From CBC Manitoba, Bart.
Hey, Dr. Rustin. Just following up on the 85 contacts you mentioned yesterday, where was that? What was the setting? Was it a faith gathering? Was it a northern isolated setting?
Yeah, it wasn't. It wasn't just from one setting. It was over a period of time, and so I don't really have any other details on that to share. But it wasn't just from one group of 85 people. It was multiple days of multiple contacts.
All right, then. Earlier today, the Premier announced that no fewer than 90 G4S employees will help out with enforcement. Clearly, there's money available for that. Assuming there's money available for more contact tracers, I'm assuming you would have requested, given that we see cash available, how many contact tracers do we need, and what is your ask of this government?
Yeah, and so right now, when we're looking at our contact tracing capacity, it's we are nearing that ability to trace 700 cases in a day. So right now we're looking to even expand that further. Of course, looking at that, if we ever reach that level or higher, we'd certainly be in a real tough spot with our hospitals. But we just wanted to make sure we have excess capacity. So contact tracing right now, we did ask for a lot of support, and we've expanded it, with public health nursing, as well as with Canada Red Cross and the Stats Canada.
From the Globe and Mail, Shannon.
Good afternoon. My question actually is about going back to Steinbach for a moment and the rally that was held there over the weekend. I know it's only been 4 days since that rally, but I'm wondering if there should be any cases tied to that rally or any of these other conspiracy-related rallies we're seeing, if that would be publicly disclosed, that there are links between this rally and known cases.
Yeah, I think if we were confident that we had some cases like that, I do think that would be something I'd talk about, just to show, sort of the harms related to this. So, I don't know necessarily if we'll be able to have that information, right? We require people's history to tell us. But if we did know that, then I do think, barring any real big privacy reasons, that would be something we'd disclose.
Sure. And my second question is about the Southern Health Authority and Bethesda. Speaking to people there, it seems like there's a lot of concern growing about those working in the stretcher service. Are you aware of any cases, positive cases tied to people who are stretcher attendants in that service? Are those being counted in healthcare cases, or is that something that the province is not monitoring currently?
Yeah, you know what? I don't have details on that. I think we'll try to look at that and see if if Lynette can provide an update on that tomorrow.
From CBC National, Cameron.
Hi, good afternoon, Dr. Rusin. Just curious, given we have leading infection rate in the country and one of the worst right now in North America, are you getting questions from other jurisdictions asking what's happening, what you know about how the disease is spreading here, or in turn, are you being asked for advice from any other jurisdictions?
Well, I sit on the special advisory committee of the Council of Chief Medical Officers of Health, so we meet twice a week, and we have throughout the pandemic. So we talk about interjurisdictional issues like this and our approaches. For instance, the schools and things. We're all that's where we discuss a lot of things like that. So. So not necessarily anything too specific. Definitely Public Health Agency of Canada, Dr. Tam, we're in close contact and checks in as well. So we have pretty good communication.
And just lastly, we're almost 3 weeks since the province went under orange restriction, almost a week since the critical red restriction. What are you personally hoping to see in the morning when you take a look at the numbers? What would give you a sense that things are starting to work or turn a tide? What are you looking for here?
Well, we're going to look at the trend, right? So we're going to start looking at a few of these trends. We're going to obviously the the total case numbers per day are relevant because a certain proportion of them will be admitted to hospital, and a smaller proportion will be admitted to ICU where we're already struggling. And then we want to see that test positivity rate coming down. And those are the sort of the early indicators that we'll be seeing. And then, of course, a sort of that week to 10 days after that, we're going to start seeing that translating into decreasing hospital admissions and ICU admissions. So the early indicators are going to be those case numbers, and even an earlier indication might be seeing the average amount of contacts per case. And so that could give us a real early sign of how this is panning out.
Thank you.
From the Winnipeg Sun, Josh.
Good afternoon, Dr. Rusin. I just want to follow up a little bit on what CBC Radio Canada asked about the thing you're asking, or mentioning charges. Regardless of that specific situation, are there situations where, under the public health orders and legislation, where people can be charged beyond being fined for breaking public health orders as a means of enforcement?
Well, yeah, I mean, the Public Health Act makes it an offense to contravene any order. And so there are very strict penalties, which could include imprisonment, but they would require a prosecution.
Okay, and looking further at some of the situations that we're seeing, could we see an increase in some of the fines that are being handed out? I know a couple of weeks ago the province increased fines for individuals and businesses, but when we're talking about some of these big box stores, they're not keeping caps on their capacity. Could we see that increase from $5,000, or maybe organizers of rallies like what we saw in Steinbach? Could there be larger increases in fines for an individual in that kind of a case? Is that on the table? Is that something the province is looking at?
I'm not aware of any immediate plans in that direction. I think the fines are one thing. If there was an ongoing event or ongoing issue in a store that was putting Manitobans at risk, we do have the ability to issue an emergency health hazard order, which would close that facility or shut down the event if necessary. So we do have things at hand that if there was immediate risk, we have the ability under the Public Health Act, but I'm not aware of any further plans to increase the fines.
Thank you.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Rusin. I wanted to make sure I understood your comments on contact tracing correctly. So you said that you are nearing the ability to trace 700 cases in a day. So that means if we hit like 700 new cases in one day, we have that capacity. We almost have that capacity to perform contact tracing in a timely way within 24 hours of getting all those contacts. And so if you can just clarify that I'm understanding that correctly. And then I just wanted to make sure I understood. So who makes the decision, who has the final say about whether more contact tracing capacity is added?
So the capacity for contact tracing, like I say, is we're thinking that we're getting to a good spot on that. We have probably over 200 public health nurses that we could assign to the case investigations, and on average they're doing between 3 and 4 cases per day. In addition to that, we have the people from Canada Red Cross and Stats Canada working on it. So we feel that we're in a pretty good spot. Now again, up until now, the cases have been very much more complex than we saw in the first wave, right? Where we saw mostly it was travel related or things like this. These are very complex cases, so that they do still put a lot of strain on our public health tracers because they're so complex. But we do feel that we've dramatically increased our capacity. As far as the final say, it's really we have a system, right? So we right now we're working in incident command, and so through incident command we would put any type of suggestions forward, and would ultimately get approved or not approved through that process. And then again with with contact tracing, especially with the case investigation that public health nurses do, it's not only about